Are you doing the surgery or is the robot doing the surgery? I get asked this in clinic every day, so let's dive in of why this is not the case. I'm Dr. JD Key and this is Bone Doc Talks. We're talking about robotic joint replacement today. So the myth is the robot does the surgery while I drink a cup of coffee and watch. Well, that's not the case. The robot hasn't replaced the surgeon yet. I'm in control. If you think of it as a GPS in your car, you get in the car, you're going to drive across town. You punch it in the GPS, tells you where to go. Avoids traffic, maybe takes a different route. That's exactly how the GPS on the robot works. It's planned. I use it to help out navigating around a joint replacement. But if I don't like the plan or it shuts off, I still know how to drive and we're going to get to the same spot as we planned. Also, with other robots that have went into the general surgeries, things are done through tiny incisions, and there's multiple arms through porthole incisions that really have made it minimally invasive. This is not necessarily the case with orthopedic robotics yet. We still have to get a hunk of metal the size of my palm in the body, and an incision needs to be made to at least accommodate that. So what does the robot navigation look like? Well, we get a 3D model of the joint. We set individual alignment goals. We measure some ligament balance, and we plan the best implant size and in the right position. And so that's where accuracy and consistency comes in. If a surgeon isn't doing a ton of joint replacements, it's low volume, there's probably more variation, and that's what studies would show. As you get into higher volume surgeons, the consistency and the accuracy is better. Now, if you add technology enhancement or navigation, it allows even further accuracy. But short-term research has shown that this isn't a difference. There's not a difference in patient outcomes, function, complications of using robotic technology. But without a doubt, the alignment, accuracy, and target areas are more consistent and more accurate with technology. And why does that matter? Accuracy matters in the long run. In the short run, we haven't shown that this is going to be a thing. We've only had it for a decade or so, maybe two. But being more accurate, does it equate to more longevity of the knee and so that it lasts longer? We don't know yet. Time is going to tell with this. If you can think of it like the evolution of cell phones, we started with the rotary phone, and then you had a brick phone that was a little more mobile, Nokia's, BlackBerry, early smartphones. Now what we have in our hand. So each phone successfully connected people on a phone call. And just like joint replacement, it hasn't changed in terms of the implants. There's been some changes, but it's still the same surgery. How we used to do it is we knew exactly the geometry of certain things, and we made just an eyeball cut with our hands. And it took a very experienced surgeon to do it well, otherwise the patient suffered. Then some smart people got together and made guides that made this cutting really consistent to what implants would be. Once more technology arrived, then in came computer navigation, which made us able to accomplish certain cuts that we just weren't able to with the guides and less invasive ways of doing things. Now we're on to robotics, which is even further technology and even more information, but it's still accomplishing the same thing, a total knee replacement, just like a phone connects people. But technology keeps on improving. We got some GPS information that maps out the joint and gives us information about certain soft tissue things. We can have a camera involved. We can video things. There's AI assistance, internet access, all these things that go into modern cell phones. So it's very similar to what technology has done in the evolution of joint replacement. So my thought on technology in joint replacement is that it's a tool for the surgeon to use, but you don't absolutely have to have it. If the surgeon is comfortable doing the surgery without this technology and has done a fair number, chances are they don't need it. But I think it's here to stay. It's just like the evolution of the cell phones. Some of it was marketing, but the paradigm shift really came when it connected us to information and made our lives incredibly easy. In my own practice as a high volume surgeon, I already know how to do the surgery very well and did extra training in it. With technology, If that allows me to be more accurate, I think I'm a better surgeon. Now, time will tell if this is going to matter in the long run, but I'll continue to advocate for my patient using technology or whatever the next thing is to make sure that they have the best outcome and the shortest recovery. I'm Dr. JD Key, and this has been another episode of Bone Doc Talks. If you'd like more information on robotic surgery, please visit bonedoctalks.com. Feel free to like and subscribe on YouTube for further videos. But until then, I will see you on the next Bone Doc Talk. Keep moving and grooving.